In today's video, we will discuss about porous load, non-porous load and mixed load in autoclave sterilization or in autoclave qualification. So we heard this terminology, we know this terminology if you are working in sterile manufacturing environment, that porous load, non-porous load, mixed load is there or are there. So what are these loads? What does it indicate? What is inside? Let's understand. So we'll begin with porous load. So in our day-to-day life in autoclave, in sterile manufacturing, we sterilize garments, we sterilize seals, we sterilize rubber stoppers. These bags are there which contain small items. Garments, the garment itself has pores. So when we talk terminology porous, it indicates that whatever you are sterilizing is porous, means there are pores inside. It's not solid, it's not a solid load, it's not a solid block, it's not a metal item. It is something soft, it is something bulk which has lot many spaces in between within the load, which creates pores, which have lot of air inside and entrapped, and that's how we call it porous load. I'll repeat. The loads such as rubber stoppers, garments, seals, or loads here we are putting lot of small flexible items like gaskets, like small plastic items which are there inside a bag within a load. It will be called as a porous load. So why we need to differentiate this as a porous load? So when we talk porous load, it has lot of small things, lot of cavities, air pockets, and it makes it difficult for air removal when we are going for the sterilization. So that's why this differentiation is necessary, that this is a porous load. So it may have different sterilization requirement. Why? Such porous load, like we are putting 50-60 garment inside an autoclave chamber, then for an autoclave cycle, for a vacuum pulse, it will be very difficult to remove the air from the porous load. If we are putting 13 mm stoppers, for example, 13 mm stoppers sometimes comes in 10,000 stoppers per bag. So if this much of quantity is in single bag and we are putting 20-30 such bags inside the autoclave, then in terms of vacuum pulse, in terms of air removal, to cause effective sterilization within these big bags, within this load of bag, it will be difficult compared to the loads which are very solid. Hence we need clear-cut differentiation that what is porous load. So as I explained, such items which are there will fall under the category of porous load. So now once we understand porous load, we'll discuss about what is non-porous load. So loads such as vessels, filling assembly, syringes, which are pure metal parts, which is metal, which doesn't have pores. Such loads, bottles, glass bottles, open glass bottles, such load which has no pores, which is not porous, which is solid. It can be metal, it can be glass, it can be any other item, but which is solid. If such loads are kept inside the autoclave, then this becomes a non-porous load. I repeat again. The load items such as SS vessels, SS filling assembly, which is connected to the tubings, glass bottles, such loads, or our sanitization load, where we have having triple bucket system, such load items which are there falls under the category of non-porous load. So in non-porous load, why it is different? It will not require much effort for the air removal because there are no pores, there is no cavities, there is no small bulked items. So that's why it's become easy for air removal from the non-porous loads. So that's why it is categorized as a separate category, non-porous load. So porous load, difficult to sterilize because it requires efforts to remove air from all the pores. Non-porous load, comparatively easy for air removal. Now there is third terminology called mixed load. So sometimes we need to have a separate load items in a single load. It can be due to the load optimization, it can be due to a specific product load, it can be due to we have defined such load initially, so that one product or one action item, one service can be done for the manufacturing process to facilitate the sterile manufacturing process. So if load is defined such a way that it also contains vessel, it contains filling assembly, and also it contains rubber stopper bags or garments or filters, then it becomes a mixed load. So this is what it is: porous load, non-porous load and mixed load. Why it has to be differentiated? Why it has to be named categorically? Because it has different sterilization dynamics, different air removal dynamics. A cycle can be designed in such a way that it will be effective in all three types of loads. Practically speaking, if we are developing a cycle which is effective to remove air from the porous, non-porous load, then it will be effective, equally more effective in porous loads where there are no much of the challenges with respect to the air removal. So hope this small video about porous load, non-porous load and mixed load will be easy for you to understand and will clarify the doubts regarding these three different terminologies. Thank you very much for watching my full video. Hope you like, and if you like, you can subscribe to my channel PHARMAVEN. Thank you.